uh, the the um, the option of for those who want to become part of our Ask Dr. Fertility WhatsApp chat room, we are going to be giving daily tips on the hydrogen therapy, on the 7 minutes, 7 seconds, sorry, morning exercises, and also different types of exercise to boost your erectile function and also to what? To discourage the ejaculation from coming too early. So listen, and then we'll give you the numbers to contact just in case you want to be part of the Dr. Fertility WhatsApp chat room. Also, we are going to register a maximum of just 50 patients because we don't want to overdo it. So it will be 50, and we hope that you will make time, call early so that you can book a space. Now let's come back to our topic, premature ejaculation. So, in fact, before I go to the premature ejaculation, let me just stress a point on the hydrotherapy. Hydro, it's a big word that the English people use for what? Water. So it's that water therapy, and this has, I mean, you can search for it. It's very, very, very useful, and it has proven very effective in terms of improving erectile function, in terms of improving erectile function, and also in terms of just boosting your libido. So someone will ask me, I will just go over it, but once you are part of the Ask Dr. Fertility WhatsApp, it will be able to give you a step-by-step description. So the aim of this hydrotherapy is to drink water when you are not thirsty. That's the first thing. You have to drink when you're not thirsty. When you are thirsty and you drink, the body goes into a mood that turns to just dilute the nutrients and excrete most of the water. Is like it goes into overload. Okay, you have that fluid overload, so you just pee most of the water. But when you drink when you are not thirsty, it actually increases the blood volume and increases the blood flow. So it's two different things. Now, how do you do? You can't fool the body. The first thing is you have to sit when you are drinking. That's the first thing. Okay, in the hydrotherapy or water therapy, you have to sit down and drink. You can't stand up and drink. No, by standing up and drinking, the body takes it to be like, oh, we are in a hurry, we have to get through with this. Bam, it will not yield the result. The second thing you have to do is you have to, when you are sitting down, you when you drink the water, you allow the saliva in your mouth to mix with the water. In that way, the body again says, oh yeah, we are just drinking because we want to drink. We're not drinking because we are rushing into something. So you sit down and you drink the water and you allow the saliva to mix with the water. The third important thing is you have to drink 1 glass of water in the morning, and then you eat breakfast. It doesn't matter whether you're eating cold rice or you're eating fufu or you're eating Quaker oats or whatever you're eating. Whatever small thing that you eat or big thing that you eat in the morning that you consider a breakfast, right after that you have to drink a glass of water. And when you are drinking that glass of water, you have to put a pinch of what we call sea salt. Okay, sea salt got a lot of electrolytes. Okay, so you put a tip of sea salt. You just tip at the fingertip and put it in a glass. So you put a tip of sea salt in the glass of water, and then you drink right after breakfast. Studies have shown that it increases the electrolytes. Okay, and you do that, at regular interval. You stop 1 hour before going to sleep because you don't want it to disturb your sleep. Now, that is just the iceberg. I hope you got something, and you will start to see the effect after 4 to 8 weeks. That is it. So consistency is very important, and that's why we want to have this WhatsApp group to be able to encourage consistency. So without taking much of your time on that, let's jump right into our topic, which is premature ejaculation. Before that, let me just take a sip of my coffee. Okay. You know, the day after birthday, and now is it. So now we start with the premature ejaculation. People will be asking, Dr. Fertility, what is premature ejaculation? So for all standards, let's first of all appreciate the fact that the what we call intravaginal ejaculation latency, that is, when you're having sex and you penetrate your partner, that time in between inside there, that's what they call, the big word for it is the intravaginal ejaculation latency period. Okay, usually it varies. But on average, they have done a study that show that men on average last between 4 to 8 minutes. That is the average. 4 to 8 minutes. Some people, I won't call name, but they're saying they can go 10 minutes right in the studio. For the people who they can go 10 minutes. I won't call that new. Okay, but they know themselves. But on average, they say 4 to 8 minutes. That's how long you're supposed to last. However, some people, even when they did a study in amongst the Arabs, and what they noticed was the men said they were dissatisfied. They thought that they were coming too early. They asked them how long they stayed. They said we stayed 5 minutes, and they said to them it was too early. So that's how complicated the definition of premature ejaculation is. We have the average, which is 4 to 8 minutes, but yet and still it has to do with satisfaction, because some people going up to 5 minutes and they still say, they are not satisfied. Okay, so now the consensus was reached because it's time bound. So we have this consensus. They say on average, any ejaculation that will start when you enter, and you only take less than 2 minutes to ejaculate. That one we call it premature ejaculation. Some people even carry it down to 1.5 minutes. Some people even carry further, okay, to what? To 10 to 15 seconds. So, but it depends on you, okay, on your own definition. But on average, anything that will last less than 2 minutes, we call it premature ejaculation. And that is the definition we are going to be dealing with. So, besides premature ejaculation, they got different names. Okay, I already said the names. Some people say, oh, rapid ejaculation, rapid climax. Okay, and then we'll come back now. You will ask, you say, but Dr. Fertility, what actually can lead to premature ejaculation? What are the causes of premature ejaculation? Now it becomes more complicated because unlike erectile dysfunction, where we have a firm, tangible, okay, evidence to say this is due to lifestyle factors, this is due to blood flow, this is due to this. Unlike that, premature ejaculation has a lot of different things. In fact, it is now classified under the diagnostic statistical manual, okay, of mental diseases or mental disorder. Okay, that is where they have placed the premature ejaculation. Why? Because it has from what? Mental tone. It causes distress for both the male and the female. And by the way, let's just retract and go back to the prevalence. Some people will ask, but Dr. Fertility, how common is this premature ejaculation? If you thought that erectile dysfunction was common, then you miss the mark, because premature ejaculation now affects between 20 to 30% of all males. Can you imagine? So there's a big, so let me break down whole percentage down thing, percentage thing down for you. So when we say 20%, it means if you have 10 males, 2 out of those 10 males suffer from erectile dysfunction. 30% is what? 3 out of the 10 males suffer from what? Erectile dysfunction. As the number gets larger, for example, 100. So if you have 100, then you're taking 20. Okay? If you have 100, 30% will be what? 30. So you see, so the larger the number, you see, the larger the cases of premature ejaculation. So already got is one of the most common, if not the most common, sexual disorder of the male. Okay, so now let's come back to the causes. I was just saying something about the causes of premature ejaculation. You see, the first study that was actually that actually tended to classify premature ejaculation was done by Bernard Shapiro. Okay, he was the dean for potency at the school in Berlin. They call it Magna School of Sexuology. So that he was the dean, and then he studied a lot of different cases. In total, he studied about 1,836 cases of erectile dysfunction, and it was based on that he classified them into two types. He said type one is what we call hypotonus. It occurs in people who show early sexual excitement. They get overexcited, like frequent masturbation. Uh, you guys, this spend out energy is so hard that your body collapse. Okay, they call it hypotonus. Hypo, it means down. So he said that's the first type. The second type is the group two is hypertonics. It's something that spend energy, but it's building up in you. So you are they are very excited. Soon they touch somebody, they come down. All the skin around the penis is so sensitive. Those are what he called group 1, 2. But later on, other people came and broke it down into type A and type B, and they further classify it into lifelong, acquired, variable. So lifelong is something that started from the beginning. Acquire or adult onset, it means that you got it, and after puberty, maybe after age 35, 45, 55, you see. And then a variable has both lifelong and the acquire. So those are the classification. And you will say, but what the essence of the classification? The essence of classification is a guide, a treatment of premature ejaculation. So we finish talking about some of the causes. Okay, they say sometimes people who pee to bed. Okay, that another one. They call it a psychoanalytical. If anybody heard about signal fraud, that theory links the mind and the body. So he said most often you will find it in people who used to pee to bed wetting. So it signals you're not able to control, your genitals. So later on in life, that predisposes you, okay, to what? Developing premature ejaculation. That another theory. So it got a lot of different theory. Some people even say because in adulthood, when you're in adolescent, when you start practicing masturbation, you won't masturbate quick, so people can't see you. So you go through it quick. So you used to going through that quick thing, and then later on your body adapt to it. Another group of people say, some people they view sex as bad. So because of that, they earlier on in life, they just used to go do quickie, 5 minute quickie. So that quickie basically now, it just got used to them. Okay? So the other group again said, no, it had to do with infection. Okay? Some people, when you have infection, and the problem with the main infection is this. You see the main urethra, the pee and tube is longer. It's about 6 inches or 6 cm. But for us females, we are just 3 cm. So any infection that goes into the tube, for us, we experience it early. So that's why you will see most times the women, they will be complaining, Oh, I get infection. Oh, I get infection. Because the tube is short, it's just 3 cm. But for the men, it's 6. So it will take time for that infection to be clemmy, clemmy, clemmy. Most time, once you are a male and you start experiencing, those discharges or pee fast, or your pee burning, then mean that infection it now go far, far, far. It's very chronic. So that's the difference between, the females and the males because of our, the structure, the way our reproductive tract is structured. So sometimes the woman will complain of infection, but the male will say, but I don't feel anything. It look like you didn't want to get different boyfriend. No, your own, it will just take time because what? Your own tract is longer than the female. So I hope I provided clarification, okay, on why females usually can complain quicker when it comes to infection than the male. So now we won't open the lines because a lot of people saying, oh, Dr. Fertility, the line, you can get a chance to talk, they will call me offline. But let me go into 2 tips before. The first one is I want to tell you how ejaculation works. Okay? So the way it works, it got 2 stages. They got the emission and they got the expulsion. So the emission usually is where after you have developed intense libido, then the fluid in the penis now it starts to secrete around the area called the posterior urethra. So there where the fluid will start mixing with different glands. Fluid secretion from the prostate, from the seminal vesicle, from different places glands, it will mix. That's the emission stage. And that stage is controlled by the sympathetic nervous system. The sympathetic nervous system is the nervous system that is responsible for flight and fright. Okay, fright and flight, sorry. So it will increase your heartbeat, everything will increase on your blood flow, everything. Then it will move to that part what they call the expulsion. That expulsion is like putting out. Okay, that expulsion phase is actually governed by the autonomic nervous system and the somatic. So it's all got to do with the body. Okay, physical contraction to push the semen outside. So those are the 2 phases of ejaculation. Any one of them, once it's hasting, you can suffer from premature ejaculation. Now, let me just tell you before I close some of the treatment, okay? Because next week we're talking about male infertility. The female then complaining too much. They say so male business I'm talking about. I'm doing my research on males. So I will not leave males topic. So let me tell you some of the treatment for premature ejaculation. Some of the treatment are just something that people speculate, but it's in the literature too. The first one, some people say, maybe I will not tell you the medical treatment because I don't want people going to buy medicine, going to take it because you have to go through the test. I will just tell you some of the physical and everyday thing. So the first one, people say that premature ejaculation is because the penis is very sensitive. So anything that will reduce the sensitivity, it will reduce the time, and prolong the ejaculatory period so that it will delay. So people say maybe you can double your condom instead of using, if you're using condom, instead of using one, use 2. It will kill the feelings. Some people they got the Masters and Johnson method, what they say the squeeze method, that has worked for people. What it does, but only thing some people complain that it's a bit troublesome because then doing sex, once you have that feeling, that you come in, then you allow your partner to squeeze the hair on your penis, then that feeling will go back, then you'll start all over. They got another one they call it start and stop. The same way, when you feel like you coming, you stop. All of your just freeze. You just signal to your partner, you just freeze. The whole feeling will freeze. Then when you go down again, then you start again. Some people saying too, before you be hard, just enter. While you getting hard, you already in the person vagina. So it already it will delay the time. All of those things are tips that people have provided. However, we got more medical solution because premature ejaculation has a mental disposition and also a physical or somatic that has to do with your body. The treatment depends. Sometimes it's antidepressants, okay? The serotonin reuptake inhibitors have shown good progress and efficacy. So those are all different types of medication we use. Sometimes, and in most cases, when it's due to infection, we have to do the urinalysis, do the culture, track the infection, and treat. And also all of the treatment have to go with psychotherapy. It means talk therapy. So I will stop there. I will stop here and give you the time to call. So our numbers to call are Lone Star 0 555 995 995. Again, Lone Star 0 555 995 995. We also have an orange which is 0 777 700 995. 0 777 700 995. So you can call in, and if you have any question on what we have just spoken about, or even from the beginning what we talked about, you can go online, you can watch the entire episode. You can also go on the Godwin Reproductive Health Fertility Facebook page. There we got all the episodes from first to the last. Hello. Hello. Yeah. Nice to meet you. Go ahead. Okay. Mm-hmm.
Can you please walk away from your radio? We're having a terrible feedback from the radio.
Thank you. Hello. Mm-hmm. Go ahead. I'm okay. Mm-hmm. Mm-hmm. No, you don't need. You don't need cleaning up. But I will answer your question. Let talk to more people. I will throw light on your question. Hello. Yeah. Welcome. Yeah. Hello. Welcome to Doctor Fertility. Mm-hmm. Okay. I will answer that question. Hello. Hello. Yeah. Welcome to Ask Doctor Fertility. Okay. Go ahead. Yeah. Go ahead. We listening. Mm-hmm. Mm-hmm.
even know that she has it. So you were talking about the, that 6 inches and 3 inches to experience the infection first. But I think, I just need more light because normally I always experiencing it before her. Secondly, you were talking about putting a pinch of sea salt in the water, and drinking it very early in the morning. That's a good thing, but I want to know whether it will not affect you if you're a pressure patient. If you say it's good for blood flow, but if you're a pressure patient, does it have any effect? I don't know the quantity of things in the pinch. But can you address that?
Okay. Hello? Hello?
Hello?
Yeah, go ahead. Welcome to Ask Dr. Fertility.
Yeah, thank you very much. Let me go to the job.
Mm-hmm.
I call my business.
Okay.
Yeah, I have two concerns.
Okay, go ahead.
Well, one, when I know after whether the consumption of alcohol
Mm-hmm.
play a part in premature ejaculation.
Okay.
The next one is how can I get in contact with the health center and what they because if someone wants to go through the treatment.
Okay. Thank you. We'll answer you. So again, the person that asked we just hello.
Hello?
Yeah, go ahead.
Yeah, good morning.
Morning, how you doing?
Yeah, like all in the start of this, okay, the woman company that is feeling, I'm going to be the who you have in the problem.
Okay. Hello? Hello? So, okay, the numbers to call now are 07777700995. That's the orange 07777700995. You can also call the Lone Star, which is 05555995995, 05555995995. So, let me just tend to ask to answer your questions while we will open the line. Oh, okay. Hello.
Good morning.
Morning. How you doing?
Yeah, this is the Dan. Boston. Oilambia.
Okay. Welcome.
Hello?
Yeah, I'm listening, Mr. Dan.
Yeah, I have a problem on 3
Mhm.
back.
Mhm.
I'm still to visit from home and
Mhm.
and my first, but early morning,
Mhm.
I'm home by about 7 days at the same one. So, morning,
Mhm.
I'm by my about 8. Pero,
Mhm.
what is this? When they broke, I went to my when I do,
Mhm.
there is a station. And you can
Mhm.
so I'm not to keep it. But
Mhm.
then God, to me, so I think anything and went down. But if I there, and then I there with thing,
Okay.
I didn't like it. So can you tell me the solution to that?
Okay. Yeah, we can help you.
Huh?
Yes, it's possible to help you. It's
Oh,
possible.
what?
But I will call the numbers because then when it's like a triage, so I will call the numbers. Then we know what your problems are, and then we can see, you know, how to address them. Hello,
Hello?
yeah,
Hello, hello?
hello, hello.
Okay, I'm David Kochi calling from Brazil. There's
Welcome.
already no problem you getting me.
Yeah, I getting you.
All right, thank you.
Yeah.
Is there any medical reason or condition for people going, for people that ejaculation at all?
Oh
I
yeah.
know some friends, some members, some people do not ejaculate at all. Is there a medical reason for that? And then, number two, what happens to such people? You're having sex from. The next thing is, why do people
Okay.
It's 4 to 8 minutes, that is true, but some people go for 45 minutes, 1 hour, and some don't ejaculate at all. What are the major reasons for that? Thank you.
Thank you, sir. Thank you. Hello. We're trying to answer some of the questions because the time. So please, we will call the number. Afterwards, you can also contact us. Now we will not be able to receive calls because we need to answer some of the questions. So the first, I will start with the last caller. I hope you hearing me clearly. So he was asking, is there a medical reason why people cannot ejaculate? So that, yeah. So yes, again, the issue of ejaculation, I already explained the processes of ejaculation. They got the emission and they got the expulsion. And those two activities are controlled by two different components of the nervous system. One is controlled by the sympathetic nervous system. The other one is the autosomic nervous system. So again, and then the entire process is controlled by the cerebral cortex. So any condition that will affect the nerves, okay, will also stop you from ejaculating. Okay, it will not stop you from getting erection, but that ejaculation. The second thing is, if anything happened to the ducts or the glands that secrete, okay, or fluid into the posterior urethra, for example, the seminal vesicles, the prostate glands, all those glands, if you're having issue with them, they're not secreting the semen, you will not see it outside. So again, that another factor. The third one, because we got a question and we against time, the third factor would be some of the medications that you're taking. Now, the SSRIs, the serotonin reuptake inhibitors that I talk about, that people can use sometimes to treat premature ejaculation, it can also cause delay, okay, or prolonged ejaculation. That's the side effect when you take it for long. So again, medication, diseases, the nerves. I hope I was able to answer the question. You said some people again they can go for 40 minutes. Again, that would be way under the box. The max we have noticed is like 10 minutes or so. But if you see anybody going again, and let me stress, they got extremes for everything. What we're talking about is but anything beyond that 15 minutes, then you should ask the person, they might be taking some substance. Okay, there are a lot of substances that people take to make them to go longer. So please probe that person. Okay, it may not be for nothing. And we got another question again. I want to talk because that was the one female caller about the family planning. If no, you don't need to clean yourself. And let me just talk. I can't wait to get on the female thing because that cleaning up thing is a big problem and it can also lead to infertility and infection. You're not supposed to clean up. Nobody should ever tell you to clean up. The only time you can clean up if you got pregnant and you aborted and they did an ultrasound and some of the tissue or the baby left there. That one is justifiable. You can do cleaning up. But you just talk family planning, okay? And you don't get pregnant, nothing. So what they cleaning up? In fact, the cleaning up will do more damage because it will introduce infection and the infection there will pull the walls of the uterus apart, and when it stick apart, when it stick together, sorry, you will not be able to get pregnant because why? There will be no space for the baby to implant. Family planning is very good. But if you're having problem with family planning and what it is, first of all, let's break the stigma around infertility. When you can't born as a woman, that issue is not only for you. Take you and your partner to the doctor, the fertility doctor, to do tests. We can do 2 of your tests. It's only after that that we can say the problem on you. Okay? But you can't just assume that because you took family planning for 7 years. Whatever they mean, the statistics have shown, sorry, that the incidence of infertility, male infertility, is equal to that of female. Why? Because the same chance you get for getting pregnant and the same chance the men get for making you pregnant. Okay? So it's almost 50, 45, 50. So in cases like this, before we start a treatment, and there's a treatment for it, but before we start a treatment, please bring two of you come and let's do the counseling, let's do the testing, let's do a semen analysis, let's see everything. Then before we conclude, but don't put yourself on the cleaning out thing. It will lead to more damage. So please, and the number to call, and I will give you my number. You can call me, my dear sister. It's 0776541177. Okay? 0776541177. Please call and don't let anybody to eat your money for nothing on cleaning up. Masturbation, we talk about masturbation. If you go to the Godwin Reproductive Health Pharmacy, some of the videos they upload from the OKFM has to do with masturbation. Masturbation, I already said it, is not bad. Okay? Masturbation has been shown to be good. And between 40 to 60% of men, they masturbate. Why 30 to 40% of women masturbate. So it is not bad. But the thing that can make the masturbation bad when obsessive, when you can't stop masturbating, when it interfere with your everyday life, when it interfere with your friendship, then masturbation becomes what, a mental problem. So, but on average, it is not bad. The issue of STDs, the male, my brother said he, instead of the woman, what I'm saying is anatomic, is the anatomical explanation for why women, are more predisposed to reporting infection earlier than men. However, like I said, for everything else, they got exception. So you might be that exception. Maybe you're very sensitive. So it's nothing wrong with that. It's good because then you guide your partner. So please don't feel bad. And the sea salt I'm talking about, again, once your pressure is well controlled, it's something that you just take with a pinch of your finger. It helps with even the pressure because that sea salt is not like the ordinary salt. It has high content of electrolytes. And electrolytes is something in the body that we need to for contractility. When we say contractility, it means to push and pull, push and pull. So like how your heart can be beating, push, pull, push, pull. The electrolytes can even support your heart to beat well. So you only taking a pinch, put it in the glass of water, and then drink it one time a day after meal. Okay? So if you're having issue with the measurement and stuff like that, you can reach out to us. Again, it will be part of the WhatsApp group for those who are interested in knowing some of these things. And we say come, and some people have proposed, but we are saying we take this entire month to be able to structure our WhatsApp group and see, and then we will provide daily tips for all of those that will be on our WhatsApp group. So if you have any doubt like this, we will be able to provide. Alcohol indeed has a big part to play again in sexual dysfunction. So please, if you are taking alcohol, stop alcohol. If you are smoking, you need to stop. The types of food high in cholesterol, oil, red meat, those things are not good for sexual what? Function. Why? Because it reduces the blood flow. It compromises the vessel contractility and integrity. So it's because of that we say if you are taking alcohol and you are experiencing sexual reduction in your sexual pleasure, okay, then please start talking to somebody and leave the alcohol and get on something productive. So again, I hope I'm able to answer all of those questions. For those who have more detail, want to talk one on one, you can call Dr. Fertility on 0776541177, 0776541177. Again, 0776 5411 778. We thank you for everything. For those who just called to appreciate me. I mean, it, through the week, every day I receive no less than 4 or 5 calls on average. Every day I receive it. Some people, now that they got problem, some people just to say thank you. Every time they will say thank you. In fact, those who listen, I went to the work and somebody said, we listen to you in a taxi. I learned that a lot of people are listening to me, through the taxi. And I say, what's up? Hi, have a nice day. Pay attention to your sexual health. People call me from Nimba, they call me from Sino. It just, when I thought to, start this, I was like, how will it be received? But it's like, they are pushing me. Even today, after the birthday, I was a little bit sluggish. People started calling me, Dr. Fertility, waiting for you, waiting for you, Dr. Fertility. I said, oh, I running late. No, make it go, waiting for you. No running late, baby. So, it's like, the people, they making palaver, but it's good because it pushed me to do it every day. I get encouraged. And I also want to thank the OK FM family. Follow our OK FM TV page also to get latest updates on other issues. And again, I say thank you, and we look forward to our next discussion next week on male infertility. After that, we are going to shift now to female topic. But mind you, I say I do my research in male sexual and reproductive health. So I will continue to provide tips as we go along for our men. Thank you and have a nice day. Bye.